Presentation of this ViewFinder episode is locally supported by UC Davis Health System. Sacramento Metro paramedics answer the call 24/7. Medical emergencies large and small. Patients are stabilized and transported by ambulance to the emergency room. But California's emergency rooms face a serious overcrowding crisis, and the prognosis for the future isn't good.
It will probably get worse before it gets better. I don't see a way of an easy fix out of this.
Solutions are out there, but everyone agrees it's a system in need of its own lifeline.
Right now, many of California's ERs are in critical condition. They're barely hanging on.
A cool spring evening, perfect weather for Walt Lytle to hit the running track.
I come here at the track once a week.
He'll run 5 miles tonight.
I didn't. I'm not too good at the wheelchair thing yet.
2-year-old Malia Jeffers is also about to do some laps.
You ready, Mama?
Her parents carefully place her in a wheelchair.
Gotta put your seatbelt on, huh?
And take her to the roof of the Lucille Packard Children's Hospital in Palo Alto.
Sun in your eyes, baby.
While Walt prepares for a 31-mile race, Malia's parents prepare for a lifetime of mobility challenges for their little girl. What Malia and Walt have in common, they both went to the emergency room with vastly different outcomes.
June of 2010, I was running with my running group, and we went out for a 14-mile run. And I made it to a 9-mile place. And at that point, I told my friend, hey, I'm gonna walk for a while. I took 2 steps and I fell to the ground.
This is medic 53, we're on route code 2 on board Bravo 3.
In short, they say I passed away. I had CPR done to me until the medical people got there, and then they shocked my heart.
Walt went to the emergency room as close to death as a person can be. 90% of people in his condition don't make it.
And I had an irregular rhythm to my heart, and then they got me to Mercy Folsom.
Doctors used advanced life-saving techniques to bring down his body temperature, get his heart going again, and save his life. With a stent in place, today he says he feels better than ever before.
I'm a very spiritual man, and I'm very thankful for each day that I have, prior to and after. But now that it's after the episode that I've had in my life, it's just a great appreciation for each day that we have here.
If Walt's case is at one end of the emergency spectrum, initially it appeared little Malia's was at the opposite.
So we were at our traditional Hmong New Year, and she was running around like a normal kid. And then the next day, she got a fever. We gave her Motrin, played all day. And then that night, she, it's typical, she was really tired and didn't, had a fever. And then the next day, we gave her Motrin again, and she was just tired, not like overly tired. And then the only reason to trigger us to go in was she started bruising.
I knew something was wrong. When your child is limp in the body, and we've given her Motrin, given her medicine, her temperature still hasn't gone down yet. We knew something was wrong right away, so that's why we took her.
According to Ryan, as they waited in the ER lobby, Malia's condition worsened. Minutes turned into hours. While they waited, a Streptococcus A infection was ravaging Malia's organs.
I'm walking back and forth crying with my daughter because she's in pain. And we're sitting there just like, what do we have to do to actually get seen?
We took her in there and she was talking, normal, just sick. Talking, walking, and a couple hours later, she couldn't move.
As hours and hours went by, and me doing the right thing and making sure that they're at least checking up on her, and that wasn't even me forcing to them. I said, you got to check her out again. Leia and myself were both in tears, like, what should we do? Should we take her to another hospital? And Leia was thinking maybe we should, and I was thinking, well, hold on.
Ryan says he finally forced his way into the medical area to get his daughter seen by a doctor 5 hours after arriving. Her liver was failing. Near death, Malia was transferred to another hospital and then flown by helicopter to Lucille Packard Children's Hospital in Palo Alto under the care of Deb Franzen.
I think when she first came in those first 24 hours, after she arrived, I wasn't sure she'd survive. So we had a pretty serious conversation, a care conference with the family, with both the plastic surgeons and the orthopedic surgeons, with the family, to really talk about the seriousness, of this and what needed to happen.
The only way to save Malia's life was amputation.
If we didn't amputate her hands and feet, then she wouldn't make it, because they were what was killing her.
Both of her legs, her left hand, and most of her right hand had to be removed.
It's going to be a big change in our life and in our kids' life, but there's technology nowadays, the prosthesis and stuff like that. She's going to be able to walk again. And to me, that's what really matters, is that we got to have her, and that's what we wanted.
Malia's parents have filed a lawsuit against Mercy Methodist in South Sacramento, where they initially took their daughter. The doctors and nurses that saw Malia are also named in the suit. The hospital declined an interview request citing patient privacy, but a statement from Mercy Methodist said they are profoundly distressed and are working with the family to support their needs. Which brings us back to Walt. His story is a testament to the fast action of passers-by, paramedics, and ER staff. He goes to the ER barely alive, and look at him today. Malia went to the ER with a fever.
Exercise your legs. Good girl. Yeah. Get it up there with your hands.
More than 35,000 people go to California's emergency rooms every day. That's more than 1,400 every hour. Our ERs are overcrowded, leaving doctors frustrated and nurses overwhelmed, patients waiting for care. Some wait for hours, and every day 1,200 people give up and leave California's ERs without even being seen. So what went wrong? If you want to see a busy emergency room, stop by on a Monday. The first day of the work week is traditionally the busiest, and at Dameron Hospital, busy means crowded.
This last year, we were right on the verge of seeing 40,000 patients.
Hi.
We're expected this next year to go to about 45,000.
45,000 patients, 19 beds with a bit of privacy, and 2 beds squeezed into the hallway. For Dr. Brad Ranke, it means little downtime.
Right now we're basically pretty full, and yet we'll have times when this board will be full, and actually down below where you can even see it, it'll start scrolling. There'll be so many patients on it.
Azire, take her down to triage.
Today, Ingrid Acasiano and her daughter Azire are visiting Dameron's emergency room.
Okay. So what brings you in today?
I've had this cough for like 3 weeks.
Around here, the nurses call it a twofer. And at this busy emergency room, it's not uncommon to see 3 furs, even 4 furs. Whole families coming in at once, often for non-emergencies.
Pink eye, possibly conjunctivitis as they call it.
Yes, they could have gone to a primary care doctor, but are Ingrid and her daughter to blame for our ER crisis? Well, it must be more complicated than that.
I think people have the misconception that ERs are so overcrowded because we see a lot of people who really aren't sick. Actually, that's a pretty small population.
Patients with minor illness are not crowding emergency departments.
Dr. Peter Sokolov is the president-elect of the California chapter of the American College of Emergency Physicians, a group that advocates on behalf of the doctors working in emergency rooms. He says patient ER abuse is not to blame for the overcrowding crisis.
Every day we see patients in the emergency department who have been waiting for days or weeks to see their primary care physician, but because of their lack of access, their situation has deteriorated and they now come in with a true emergency.
Did you call your doctor?
Yeah, and it was like probably March 15th was the earliest that they could get me in.
March 15th? What's today?
Today's the March 7th, and I called in the last week of February. I was kind of just waiting to see if, everything else went away, so I was assuming that it was just going to go away.
13 million people go to California's emergency rooms each year. 7% of those are for non-emergencies. That's just over 2,000 a day. Hospitals are using new ways to reduce the number of people walking through these doors for non-emergencies.
Hi there.
How you doing?
Good.
Dr. Patricia Samuelson has a passion for practicing medicine in underserved communities. She's not surprised that people are ending up in emergency rooms for non-emergency care.
There is a shortage of primary care people, period. There are practices that you just can't get an appointment even though you may be assigned there.
Did you need any refills?
Dr. Samuelson says less money in primary care medicine and also a huge administrative burden keeps physicians away. But there are places to turn for primary care.
And the nurse talked to you, right?
Mercy hospitals are now targeting non-emergency ER patients and following up with them, giving them information and access to clinics like this one in Sacramento's Del Paso Heights neighborhood.
Alrighty, all set.
Right now, it's a pilot program, but with 75% of patients that have followed through no longer going back to the ER, they consider it a success and they want to expand. The goal is not only to relieve some ER overcrowding, but also get those patients preventative care for the future.
The ER is staffed, trained, and equipped to take care of acute injuries, acute critical illnesses, things that I wouldn't want to touch with a 10-foot pole. That's what they do. That's what they're there for. But they do not ever hold themselves out, nor are they equipped, staffed, or trained to manage chronic disease, and certainly they provide no preventive services.
Although they often get blamed for it, national studies have actually shown that it's not the uninsured that are causing ER overcrowding. So ER abuse and the uninsured are small factors in the overcrowding crisis, but if you're in that waiting room, waiting for care for something serious, like Malia Jeffers' parents were, seeing people take advantage of the system can be maddening.
I was paying attention and very aware of the people going in front of us because we were told we would be next, and they're the same people. They're the same people going in there saying they have chest pains, and a couple of them are homeless people, and they were already there last week. And the nurses tell them that, you gotta leave, get out of here. You already seen last week, you have a prescription, go see a doctor. And these people were taking up time from us getting seen. It makes me just furious thinking about it.
It's a California penal code deputies Scott Hyatt and Paul Pace know well. They're the Sacramento County Transient Enforcement Detail covering the entire north section of the county, handling citizen complaints about homeless encampments and disturbances. 5150 is the California legal code for involuntary psychiatric commitment.
Get him, guy. Can you get up for a sec, Mark?
And besides alcohol and drug addictions, many homeless people struggle with mental health issues.
You all right? Where you at? Where's your head? Oh, there you are. How you doing? All right. Hey,
sleeping on a sidewalk behind a restaurant is Mark.
Is that cool? He's been here so long, the teriyaki place here, they usually just feed him.
He's been living here for the past 10 to 15 years.
He's not an alcoholic. He's not a drug addict. He is mentally impaired, but he's not a danger to himself or others. He just lives on the streets. Probably 2 or 3 times a week. People see him, they call for welfare checks on him, they call because he's yelling, but not at anybody. He just likes to yell and walk on his way.
Until 2009, this was the place where deputies would bring someone like Mark, the Sacramento Mental Health Crisis Stabilization Unit, a county-run facility for people facing mental health emergencies.
When we had the mental health center that was available to us, we could take Mark down there, our guys down there like that. They could keep him there long enough so they could get him on medication and get him stabilized.
Today, the crisis center is no longer taking patients after its county funding was cut in half. Walking through the facility is a bit surreal. Empty chairs, tables, nurses' workstations. The crisis center closed its doors in the fall of 2009, a victim of California's budget cuts.
We used to get $19.6 million annually for what they call managed care funds, which is to be used for inpatient services. And for fiscal year 9-10, that was reduced to $9.6 million. So it was a 50% reduction in 1 year.
We can institute it when there's funding again, but
Dorian Kittrell is the executive director of the county's mental health treatment center. He says the initial closure of the crisis unit was a huge shock to hospitals because the only place to take people in mental health crisis became emergency rooms.
I think every emergency department has been impacted with it, and from a staff safety issue, from a bed capacity issue, from a patient care issue, there are problems.
We average 3 to 4 patients a shift here for some kind of psychiatric complaint. Sometimes we have 2, sometimes we have 10.
Can we give you another guide about programs and stuff?
Deputies have taken Mark to the ER in the past.
We've done that with him probably 10, 12 times. He lays down on the gurney, he's cooperative. He screams a lot, rattles other patients. He doesn't attack anybody, he doesn't threaten anybody, he just likes to yell and scream. And in an ER setting, you can imagine that is not what you really want to have with the other patients.
The issue is compounded because budget cuts actually cut the number of county inpatient mental health beds in half. So once a patient's mental health situation has been stabilized, they can actually wait in the ER for days until a room opens up at the mental health facility.
These are people who are ill with a psychiatric problem and really need inpatient help. And there's no inpatient beds available for them anywhere in the county because of budget cuts. So they're here waiting for 3 or 4 days for a bed to become available.
We've had people here for up to 5 or 6 days waiting for a bed. That's on the long side.
John Boyd is in charge of Sutter Medical Center's mental health services. He says the noise, lighting, and beeping machines in emergency rooms are the opposite of what many mental health patients need for recovery. So the sooner mental health patients can get out of the ER, the better.
For individuals facing a sudden behavioral health event, the kind of care they need is everything specific to the type of lighting in the room that can create a more calming environment, controlling the noise and other environmental influences in that space that does support kind of the calming of the individual.
Do you want to go to the hospital? You do? Okay.
Back on the street, the deputies get another call. A 24-year-old man with bipolar disorder says he has anxiety. His mother says he just likes to ride in ambulances and has a fascination with emergency personnel.
She wanted to take him home because she said he does this all the time, and he's a very frequent 911 caller to our communications center. And he's never a problem. He just likes to talk to sheriff's deputies and to firemen.
He gets his wish, full complement of paramedics and law enforcement, and a trip to the ER in an ambulance.
He would have gone to Schmick.
In the past?
In the past, where he could get some help.
But now he's going to ER?
To ER, where they're going to be overburdened and try to, because there's nothing wrong with him. And the medication he just took, by the time he gets seen by a doctor, will have kicked in and he will be calm.
So
it's costing everybody a lot of time and money.
You'd like to think this is an isolated example, but according to Deputy Hyatt, these calls come in
several times a day, every day.
Right now, the old Psychiatric Crisis Center is a clearinghouse of sorts, tracking mental health patients at emergency rooms and looking for space at psychiatric facilities for long-term care. While there's no doubt the impact has been felt at hospitals, Dorian Kittrell says it also is providing an opportunity to look for better ways to deal with people facing mental health crisis.
And I think that even as the crisis does continue, we're still going to find ways to work together.
A solution can't come soon enough for the county deputies because the current arrangement...
It's not working at all.
The quiet is deceiving here at the UC Davis Medical Center Emergency Room in Sacramento. This is a Level 1 trauma facility. That means critical patients come by ambulance and helicopter from miles around. Victims of car accidents, gunshots, heart attacks. When you see about 60,000 people a year for all ailments and injuries, there is no such thing as a typical day. You have to be able to go with the flow. This emergency room was recently expanded to add more space and improve the flow of patients in and out of the ER. And while the men and women who work here have their internal flow worked out, it's the overall patient flow of hospitals that is one of the biggest challenges facing emergency departments.
When a patient comes to the emergency department and we treat them for their emergency condition. Sometimes they require hospitalization. Oftentimes, there is no hospital bed available for them. In that case, they will wait down in the emergency department for sometimes several hours, sometimes several days.
It's known as boarding, keeping patients in the ER while they wait to be admitted to the hospital. In 2008, the Emergency Room Physicians Group, ACEP, cited the practice known as boarding as the primary culprit to emergency room overcrowding. In California, 15% of ER patients end up getting admitted to the hospital. That's about 1.8 million each year. Problem is, there's not always room.
Imagine if you had your loved one and you had to lay on a hard ER gurney for 24 or 36 hours while you're waiting for a bed upstairs. Luckily, we don't have that right now, but a lot of the ERs around the country really do.
This happens very frequently. Boarding and crowding occurs daily at many facilities.
Dr. Sokolov's organization says simply adding more ER beds is not the answer. Innovative ideas are the key to dealing with overcrowding. And that brings us back to Dameron Hospital in Stockton. Not long after Ingrid and her daughter are examined, it's time for something called board rounds. Every 2 hours, this small staff crowds around the cramped nurse's station.
And 2B, 48-year-old male, like symptoms, wait for lapse.
And one by one, they go down the list of every patient in the ER, their symptoms, their status, and how soon they'll be treated and on their way.
4B? 4B is gonna go home.
This may not seem like a big deal, but it's actually rarely done in emergency rooms, stopping down and communicating with everyone about every patient.
So that we can keep track of where everybody's at on a consistent basis so that patients don't get lost in the shuffle, basically.
Always gotta get your weight first, okay?
It means Ingrid won't have to wait long for care. She's been seen in the fast track section of the ER. She gets checked within a few minutes of arriving and is seeing a physician assistant a few minutes later.
They never even get back to the main emergency department. And a second group of patients will come in that need x-rays, need labs. Those will all be ordered up front. So as soon as you walk in the door, you'll get seen.
Changing the initial routine for patients is something fairly new for ERs. Instead of walking through the door, checking in and waiting to see a doctor.
For instance, Dr. Robinson is working today, and as soon as the patient walks into our waiting room and they know that they need one of these higher acuity beds, Dr. Robinson knows and owns that patient in the waiting room. So we'll try and get them in to see Dr. Robinson as soon as possible. And we've created a culture here that we don't want to have patients in the waiting room at all. So we'll do whatever it takes to get them seen as quickly as possible.
At Kaiser, the changes have meant dramatic improvement in wait times.
Before we did these changes in our design, patients would be waiting in our lobby 4 or 5 hours to be seen. You never know, one of those people could turn out to have a critical illness or they worsen in our waiting room. We think the most key thing is getting a patient in front of a doctor as soon as possible.
The average wait time to be seen at Kaiser is now 24 minutes. And at Dameron, Director Sherry Shirey has been around long enough to see a dramatic impact.
When I first started here, it was not unusual to have 6, 8, 10-hour waits.
Today, a patient will see a doctor or physician's assistant here within 15 to 20 minutes, and the hospital has plans to expand the ER. But are all of these changes enough? Will they turn the tide? Is more regulation the answer? State Senator Ted Lieu introduced legislation to mandate reporting of hospital ER overcrowding.
My bill mandates that emergency rooms have to do a check every 3 or 4 hours, see the overcrowding level, have a point system, and if they get to a certain point where they're too overcrowded, then they have to take action, such as bring in additional staff.
Measuring crowding absolutely puts everyone in the entire institution on notice that this is a serious problem. Emergency department crowding is caused by hospital crowding. It's not an emergency department problem. It's a problem of the entire institution, and it requires a solution across the entire institution.
But not everyone in healthcare believes adding more regulation will help the problem. In fact, hospital administrators point to California's mandatory nurse-to-patient ratios in emergency rooms as a factor in overcrowding. The California Hospital Association also cites a shortage of ER physicians as a reason for overcrowding.
Okay, I'll talk to her, let her know what's going on, and get you set up. Okay, right.
There are solutions to overcrowding. The turnaround at an ER like Dameron is proof of that. But despite the hard work by the men and women in emergency medicine, those who are in the front lines paint a grim picture for the near future.
We're plugging it up by finding these creative answers to get people in and out of our emergency departments and get them upstairs, but at some point, you know, it's still a system issue that we got to deal with.
And right now, the system is strained. Fire department budgets have been slashed. Law enforcement staffing cut. The social safety net isn't just frayed, it's barely there. Throw in an overwhelmed healthcare system, and you've got the perfect storm.
Unfortunately, most likely the situation will get worse before it gets better.
Not comforting words for the 35,000 people who will go to California's ERs every day. In the meantime, Ryan Jeffers wants his daughter's story to be a rallying cry for change.
We got our girl back, that's what the main thing is, and if we can help you know, touch other people's lives through her, which, you know, having her walk again and stuff like that, I think will maybe open some eyes to other people, you know, and that's what we want to do now.
To order a DVD copy of this program, call 888-814-3923 or visit kvie.org/viewfinder.
Presentation of this ViewFinder episode is locally supported by UC Davis Health System.